President Biden is predicting that the U.S. pandemic deaths will exceed 600,000 people before this is all over. But the numbers also show hundreds of thousands of people have recovered from this disease. So if you've had COVID, what do you have to do to make sure that you stay healthy? Joining us to talk more about that today is Dr. Fahmi Farah from Baylor Scott & White. Thank you for being with us today. Really appreciate it.
Thank you for having me. It's a pleasure to be here.
All right, so you've been on the front lines of this fight. Can you tell us some of the things that you've been seeing? We know that this has really been a learning process for medical professionals as they've been dealing with this over these months. What are you seeing?
Yes, it's been, about a year that we've been dealing with this pandemic. Right now, our hospitals are quite full still. We are in the midst of a surge as a result of the holiday season that we saw. So we're seeing lots and lots of COVID patients. We're seeing a lot of people actually coming back with a second time COVID infection. Many of them are sicker when they're getting reinfected with COVID. A lot of patients with complications related to COVID as well that we're seeing in the front line. Lots of heart complications, such as heart failure, heart attack patients. So yes, we are still in the middle of it, battling right through it.
Boy, that's really staggering, Dr. Farah, because I think a lot of people assume that once you've had it, you've got the antibodies, you're good to go, you don't have to worry. That suggests very much otherwise. So if somebody has had COVID-19, what would you say are the lifestyle changes that they need to make to avoid becoming another statistic?
Absolutely. I think prevention is key. So we need to continue to, utilize all the preventative measures that have been stated in the guidelines, such as social distancing, wearing masks in public areas, washing your hands when you get home. But additionally, it's very important to maintain a good immune health, which means a healthy diet. Heart healthy diet is also immune healthy diet. So eating plenty of fruits and vegetables, just keeping up with your diet and exercise, not to deviate from exercise. Do be careful when you're exercising, especially when you're going to the gym. I would say be very careful, wear your mask. I would prefer that people exercise outdoors rather than going to the gyms. So those would be some of the key things to keep up with: getting good night's sleep, staying in close contact with your family members by telephone for support during this time.
Let's talk about variants, because we've been talking a whole lot about these recently, these new strains of COVID, and people have wondered, can you get one of those new strains if you have already had the virus? Is it too early to tell that? But I mean, you've kind of answered the question up at the top by saying that people are coming in positive who've tested positive before already. That may have nothing to do with new variants. It sounds like you're still susceptible in many cases.
Yes, you can get reinfected with COVID. We've already seen that. We've been seeing it throughout the pandemic. And you're right, there are several new variants now that we've been hearing about. One from the UK that we believe has already made it here in the United States. It's supposed to be more infectious, this new variant. So absolutely, you can get reinfected with different variants. And that's why it's so important to not let your guards down, even if you have already had COVID and have already recovered. It means that you can still get reinfected and still be a carrier to others. On that note, I also want to point out for people who are getting vaccinated, I would say that, when the vaccine becomes available to you, it is a good idea to take the vaccine. I know there's a lot of anxiety around the vaccine. I want to tell you as an example that I have taken my vaccine. I was one of the first people in the state of Texas to receive it, and it went well, So I do urge people to take the vaccine as long as they don't have any, allergic reactions to any of the ingredients or any other contraindications to the vaccine. It's a good idea to take the vaccine.
All right, Dr. Fahmi Farah from Baylor Scott & White, thanks for doing this with us today and taking the time. And a big thank you for what you do every day, you and your colleagues. I don't know how you all are getting through this. It's been a busy time, and it has to have been traumatic for you in a lot of ways, but thank you for what you do.
Thank you so much for having me, and that acknowledgement, I share it with all my colleagues. Indeed, it's been a very difficult year for all of us.
Yeah, please pass it along from us. Thank you.
Thank you.